I'll give the floor to Ludovico.
Thank you very much, Elena, for the introduction. If I could have the first slide of my presentation, thank you. So, welcome to the third and last Peitho webinar. Today we are going to talk about the operationalization and institutionalization of One Health solutions, especially about some lesson learned from the collaboration among EU agency. How do they put the collaboration into practice? Could I have the right to move the slides? Then
Yeah,
I could do it myself.
of course.
All right,
Okay, now.
maybe I'll just, all right, thank you. Just for those of you that were not present in the previous webinars, really quickly, Peitho, this is the thematic network of One Health, which was set up in the frame of the EU Health Policy Platform. The EU Health Policy Platform is, of course, the mechanism that the DG Santé from the Commission uses to interact with the stakeholders. The thematic network are particular network which are devoted, which address one particular topic, and we address the topic of One Health. The thematic network on One Health, Peitho, is managed by the European One Health Association, and we started working at the beginning of this year, and we will finish working around September 2026. So that's where the thematic network ends. Our aim is to strengthen the transdisciplinary, interdisciplinary, cross-sectoral approach to One Health challenges in Europe, with the ultimate goal to support the operationalization and possibly even institutionalization of sustainable One Health solutions. What does it mean in practice? I'll tell you in a second. The format is, of course, the virtual space provided by us by the Health Policy Platform. The webinars, that's the last one. Please feel encouraged to join Peitho. You have the QR code here. There's also the URL, and you can join the platform using simply your EU login app. The final output of Peitho is a joint statement. Let me spend just 1 minute on this joint statement. This will be a document written by us, for the benefit of ourselves. We are the stakeholders relevant to One Health in Europe. What does it mean? I mean, research performing organization, reference laboratories, national institute with official tasks, but also NGOs, the private sector, professional associations, and so on. So the joint statement will really be a document by us, for us. And yet, might be of some interest also for the makers of policies and the makers of decision. What do I mean by that? I mean that by taking a look at our joint statement, the policymakers, the decision makers could understand, have an idea of what is going on in the field, really, regarding One Health in Europe, and then they could use this information, this pieces of information, to set up good ways, good tools to support. So the joint statement is very much a bottom-up initiative, which kind of stimulates also top-down activities. Just a brief look into the content of the joint statement. The joint statement is structured in 3 pillars. Each pillar is the focus of one particular webinar. And importantly, each pillar gives practical advices to follow one important document of the European Union, which is called One Health Governance in the EU. This document was published by the Scientific Advisory Mechanism late in 2024 and gives recommendation for the improvement of One Health in Europe. These recommendations, though, are generic. They are valid for a kind of broad range of stakeholders. We want to be specific. We want to give practical advices on how to follow this recommendation. Each pillar will address some of these recommendations. We had the first pillar on One Health Network, the second pillar on One Health Research and Innovation. We had webinars on these. The material is available in the library of Peitho. The third pillar we will address today, and that is on the operationalization and possibly even institutionalization of One Health solution. So that here is how the pillar address various recommendations of the SAM document, One Health Governance in Europe. We cannot address all the recommendation because we have a very defined end of our target, but some of them we will. All right, now let's quickly to today's webinar. We are going to hear today to discuss today about the advancement of the operationalization and institutionalization of One Health in Europe, and in particular about the lesson from the EU agency that put the One Health collaboration into practice. So the first, we have three keynote talks today. The first presentation, we will hear exactly about the EU cross-agency One Health task force. So this alliance among the EU agency, the past, the present, the future of the task force. Then we will hear something about one example of One Health collaboration between the EU agencies that it's really applied, and that is specifically on One Health surveillance. And our last keynote, we will hear about the implementation. It will be a closure about implementation of the One Health solutions in Europe, where we are standing at now. And then my colleagues from the Commission and I will close the webinar. All right, these are our three keynote speakers, and I would like to start with the first talk of the day by Ivo Klassin. Just a very brief introduction. Ivo is the head of the Veterinary Medicine Division and acting also as Deputy Executive Director at EMA, the European Medicines Agency. He has a long experience in working with infectious diseases, but also he has experience in the development, production, regulatory affairs of medicinal products. He was responsible for the implementation of the Veterinary Medical Product Regulation 2019/6, which deals with the innovation of veterinary medicines, and importantly, it also deals with the reduction of risk related to the AMR, antimicrobial resistance. This also includes monitoring of the sales and of the use data of veterinary antimicrobials. So, Ivo, we are happy to have you, and the floor is now yours.
Thank you very much, Ludovico, and thank you for the invitation to the One Health Task Force, the cross-agency One Health Task Force, to present today. I can see immediately where there's numerous connections between the work that we're trying to do and actually the work that you're trying to do. What we share is a bottom-up approach. We'll tell a bit about the history of the cross-agency One Health Task Force. And what we also share is when I looked at your three pillars, we've organized it slightly different, but there's quite a bit of overlap there. So it really makes sense that we present here. And starting my presentation today, I'm currently the chair of the cross-agency One Health Task Force. It has a rotating chairmanship. And already EFSA, European Food Safety Authority, and the European Centre for Disease Control have filled that role in as the chair of this One Health Task Force. And by rotating chairmanship, we would really like to see that everybody takes its responsibility in the development of this, let's say, network approach. So the five agencies that we have in this cross-agency One Health Task Force are ECDC, so the European Centre for Disease Control, the European Chemical Agency, the European Environmental Agency, the European Food and Safety Authority, and the European Medicines Agency, all working on their domains and now increasingly looking at where can we strengthen a One Health approach by working together. And I think we're past the first stage. We started crawling a few years ago. We're now in the stage where we can walk, and we want to move on to being able to run and eventually being able to fly. So what is this cross-agency One Health task force? We see ourselves as sorry, can you go back one slide? It's an advisory function to the executive directors of the 5 agencies. And we have as an observer DG Sante, the unit on One Health. And we can invite external ad hoc guests upon invitation. And like I said, chair is rotating. We have developed a cross-agency One Health framework for action, and I will dwell a bit about that later, 2024-2026. It is an initiative of the agencies, but it may be embedded in legislation. And we've recently seen that, for example, in the review of the regulation governing ECHA, the One Health Task Force has been introduced specifically. So, and that embedment in a regulation would, of course, increase its status and would increase also the actual power to do things. If I can go to the next slide, please. The vision of the task force is to enable EU agencies to successfully contribute to the implementation of the One Health approach in Europe, with the ultimate goal of strengthening the ability of the EU and its member states to respond to a health crisis. So I have to say that currently we are literally working as the agencies together, but we would like to see that connection to the member states as well, whether that's through the Commission or in a different way. And I think the audience of today, I understand, is exactly the audience that we would need to talk to. We're trying to move towards a more permanent and established form of transdisciplinary cooperation between the EU agencies. Looking at the 4 principles: coordination, collaboration, communication, and capacity building. We're not trying to reinvent the wheel. We work from existing mechanisms of cooperation, and we try to maximize synergies and avoiding duplication. So I think the strength of this One Health Task Force lies in the fact that we regularly meet and that we communicate what the individual agencies are doing, and that's communication then trickles down in our respective agencies, and we look actively for opportunities where we can work together, either mandated by the legislation or because we do feel it will contribute to a One Health approach. On the right side of the slide, you will find the cross-sectoral topics for One Health action, which I think are known to us all. I would like to move to the next slide, which, because I promised I would say a bit about the history and where we currently are and what the future is. The whole idea for this One Health Task Force was coined at the One conference that was organized by EFSA in 2022. And when I say it's a bottom-up approach, what was established was a coalition of the willing with individual staff members of the individual agencies, very often high up in the organization with direct connections or indirect connections to our executive directors. So the cross-agency One Health Task Force was established in April 2023, almost a year later, formally. The framework for action was published in May 2024, so which was supported by the executive directors coming together and agreeing on this framework for action. Where we are now is June 2026. Obviously, the framework for action should be completed largely at the end of this year, but then we have to move into the next phase. So we foresee that the task force will continue beyond 2026. We're looking into conversations with our executive directors to see what that continuation will look like. And as you mentioned in your introduction, we're moving now more from the planning part and the investigating part on what we could do into operationalization of and delivering really on One Health topics for the period beyond 2026. So 2026, 2030, we'll see another framework for action focusing more on that area. Having said that, there's already quite a number of bilateral or trilateral or quadrilateral cooperations ongoing between the different agencies that actually deliver on documents, whether it's guidance documents, scientific opinions, or papers, manuscripts on antimicrobial resistance. If I can move to the next slide. This is about our One Health framework for action. It recognizes 5 big elements: strategic coordination, research coordination, capacity building, communication and stakeholder engagements, and partnerships and joint activities. All for this period look into identifying where there are opportunities and establishing those links and develop joint activities wherever we can. And you have a QR code here in the slide, and the slides can be distributed that will bring you straight into that cross-agency framework for action. And I would like to dwell on each one of these in the next few slides. So if you can go to the next slide, please. The strategic objective 1, strategic coordination, is to facilitate strategic coordination in the implementation of the One Health approach by jointly contributing to the One Health agenda in Europe and strengthening One Health cooperation within and across the agencies. And I think it's important to also stress that within the agencies, because as agencies we may be very siloed, but my experience from working in the European Medicines Agency, where we have a human part and a veterinary part, which would be ideal for One Health cooperation, that even here we need to advocate for One Health approaches. The outcomes, foreseen outcomes, publication and resources to contribute to One Health agenda setting, guidelines to establish joint working groups and to promote alignment on key One Health topics, strategic exchange among agencies and their management. I think that's an important one. And recommendations on structural arrangements for cross-agency collaboration. And some of these we have already delivered or are in progress of delivering. If we can go to the next slide, strategic objective 2 on research coordination. What we'd like to do is identify common research needs and knowledge gaps. I think that's important in the work of the agencies, promote research coordination and engagement with EU research funders, and support a One Health driven research and innovation agenda setting. And I think it's clear to the audience why we would need to do that. There are certainly challenges in doing that with 5 agencies which have different legal mandates, but also independent, I would say, financial structures. But there's challenges that can be overcome. The outcomes that we see is a common knowledge hub to inform Europe's One Health research agenda. So to try and steer the One Health agenda to really invest in One Health approach for research topics. Research to better understand the interdependencies between human, animal, plant, and environmental health using a transdisciplinary and integrated approach. And efficient engagement of agencies in relevant One Health research projects and European partnerships. If we can move on to the next slide, capacity building, to support in-service learning opportunities for staff within the agencies and One Health capacity building activities and training opportunities. The outcomes are a common understanding of One Health learning needs, and we've started with that. It's very much about awareness in our own organizations on what they are working on, and that these are really One Health topics, and where they can also identify opportunities to work with the other agencies. So awareness of what the other agencies are doing, and building that network and strengthen the capacity to work together. We organize courses for in-service professionals, partnerships with universities and research centers, and coordinated One Health capacity building in Europe. Next slide on strategic objective number 4, communication and stakeholder engagement. Coordinate the agency's contribution to One Health vis-à-vis relevant stakeholders, including EU institutions, member states, multilateral bodies, and other external key players, and develop and implement coordinated communication activities. And we've recently launched our first newsletter jointly with the agencies, and we're soon to launch a second newsletter updating our stakeholders and the general public on what we are doing in terms of One Health activities. Outcomes we expect are improved collaboration, knowledge exchange between One Health stakeholders, and strengthened and improved communication and consultation across human, animal, environmental sectors within the EU. And I can say that from our own stakeholder community, we have received positive feedback, and they would like to see that communication. Yesterday in the European Medicines Agency, we had a meeting together with ECHA. The executive director of ECHA was here, our own executive director, a whole morning with our stakeholders, which is the in this case the pharmaceutical industry, both veterinary and human, because they are really looking at us to take the lead in trying to see where the different agencies and authorities can work together to bring a holistic view and move away from regulation that is developed in isolation, also looking at what is the impact on other areas of regulation. And that's really, really a One Health issue. And just one of these examples where we're trying to make that difference. We can move to the last strategic objective, partnership and joint activities. Develop joint activities on One Health, possibly supported by joint procurement based on the identified thematic priorities, thus maximizing synergies and avoiding duplication of work. And as simple as this may sound, and as logical as it may sound, it appears to be very difficult to do that. But it's through the One Health Task Force that we're more aware of where we see potential duplication of work, and we can maximize on those synergies. And even though there was numerous bilateral communications between the agencies before that, the executive directors of what they refer to themselves now as the One Health agencies come together regularly, and they are also being supported by us in really trying to make this work for all the agencies. So outcomes, mapping of the existing cross-agencies initiatives, so knowing what we are doing, know what the others are doing, and then utilize that knowledge to really better that situation. Publications analyzing synergies, gaps, and barriers for cross-agency One Health implementation. Mechanisms and proposals for cross-agency joint funding to address knowledge gaps and promote One Health implementation, and business cases to demonstrate the effectiveness and impact of the cross-agency approach. I would like to move to the next slide, which is the progress to date, and I will not dwell into this. We've summarized in one slide where we have made progress, what we have delivered until now, and the slide will be communicated. There's a lot in here, so you can see that each and every one of these strategic objectives has delivered already numbers of documents, better collaboration, defining One Health research needs and gaps. And I think it's important to see that we are very much aware that we have to do this in collaboration with our stakeholders, in collaboration with the Commission as well, and in collaboration with an organization like yours, where we will gather momentum, and we need that support to really keep it on the agenda. I think that's the most important thing. If I can move to the next slide, please. I'd like to mention here the World One Health Day, time for action, a joint statement for the EU cross-agency One Health Task Force and the European and Central Asia Quadripartite on One Health. So jointly with the Food and Agriculture Organization, United Nations Environment Programme, the World Health Organization, and the World Organization for Animal Health, we've published that statement under the title One Health, One Planet, but Our Responsibility. And I think that's a good step forward. And if we can move to the next slide, and I think this is probably the last slide of the presentation. I'm not too sure. Here you will find the QR code that links you to our One Health Compass. It's the One Health newsletter and news. I can recommend that you subscribe to that, and will automatically come into your inbox. Next slide, please. Yeah, the one message I would like to give here is that I think by this initiative we have put One Health also firmly on the agenda with the Commission. We've demonstrated our willingness from the agency side to actually work together to make One Health a success. We've identified certainly a number of blockers, but I think we're hugely positive about the way forward. This has generated a lot of positive energy in the One Health Task Force and in our respective agencies as well. People want to work on One Health because they do see the relevance of it in creating indeed a better world. In our agency we've had a development day earlier, was last week, where we had a whole session on One Health. There was huge interest from our own staff in that, and currently we are looking at the staff exchange. We've got staff here from EFSA for a full month, and we had someone from ECDC over in our own agency, and through staff exchanges we would like to build better relationships between the agencies as well, and we hope that the staff that comes to us to learn about what we are doing will give that message back, and will collect the information that they need to establish those relationships at the operational level. It's good to have it at the strategic level, but I think we need to build those relationships at the operational level. And the One Health Task Force has been instrumental in all of that. And that's where I would like to end it and open the floor for questions. Back to you.
Yes, indeed. Thank you very much, Ivo. I can just echo your last lesson learned. And I was also very happy to hear about the new framework for action. So this will indeed go on. I mean, not surprisingly, but it's good to have it confirmed. And thank you also very much for highlighting the link with the quadripartite. Indeed, there is One Health, but there is also One Planet. So I would like now to open the floor for the questions, and feel free to write them in the chat, or you can raise your hand and then we will unmute you. Maybe just so we give some time for the for writing the questions in the chat, I would have a first question or comment. So I was wondering whether you could tell us a little bit more about exactly what you were saying, the process between crawling and walking in the metaphor that you have used. If you could tell us something about the barriers that you faced. Well, you've mentioned the different mandates, for example, but especially about how you manage then to overcome those barriers. I'm sure that some of these issues are faced also at the national level.
Yeah, thank you for the question. I think it's a good question. I mean, when we started with the One Health Task Force 4 years ago, or 3 years ago, actually, people were sitting together that all were convinced that this was a brilliant idea to work together. I think, and nobody will deny that it's a good idea to do that. But there's several things there. We all have our own mandates. That's not necessarily the blocker. Everybody in the agency has a hugely busy agenda. So we have to work on our core activities. So we in the agency, the European Medicines Agency, currently has 800 staff. We freed up one FTE to work on this One Health agenda. We had to get our managers on board. So we prepared, let's say, meetings with our senior management to discuss what is actually our ambition for the agency on One Health, and do you support it? Now, if we have an ambition, are we prepared to invest in it? So and I think that's within every agency you will have that. So and then we focus largely on what is mandated through legislation. So in our veterinary legislation, the collection of sales data is mandated, but it's not on the human side in the European Medicines Agency that they have the same thing. So we both work on antimicrobial resistance, but there's no overlapping areas in there. We work with ECDC and EFSA on what is called the Joint Interagency Report on antimicrobial consumption and resistance. And in the recent brief that we have received from the Commission is also now the Environmental Agency included. And I think that's a good progression. And then we know that it will happen because then we know that people will have to free up resources to do it. So I think the biggest blocker is will it get the right priority in the individual agencies? And how do you deal with one agency prioritizing One Health and the other agency saying, well, we've got new legislation coming in the European Medicines Agency, it's the new pharma legislation, it's the Biotech Act, it's the Critical Medicines Act. So it doesn't get the highest priority. I would say that that's one of the things. And then there's the more formal things that you see in terms of funding mechanisms for the different parts of it. Despite all that, I think we're going from the crawling to the walking stage. I think we've put it on the agenda. There's opportunities to work together, but it's not really been approached from as the highest priority to do it. So we don't fully capitalize on all the opportunities that there are in really bringing One Health to it.
So apparently within the organization there is still some work to do, but then the connection between them it's what working particularly well, as I understand.
Yeah, but what I see developments that could facilitate this is pressure from public, pressure from Parliament. I would say pressure on the agencies from the side of the Commission. I think there are because intrinsically, yes, there is there's a willingness to invest in it and to do it. But I mean, the daily work is in that sense distracting. I think we have the responsibility to actively look at that collaboration, but we cannot force another agency to say we feel that you have a role to play here. But through mandates, we can do it.
Okay, wonderful. Thank you very much for the answer. Anouk, do we have any comment or question in the chat?
I see questions in the chat coming up.
Shall I read them to you? The first one actually are two questions. Which kind of topics did you select for the collaboration between EFSA, ECDC and EEA? And in the context of One Health operationalization at the EU level, how can environmental stakeholders be actively integrated into institutionalized frameworks for pandemic preparedness?
Okay, the topics, the most obvious topics, and this is one of the things you always go to the most obvious topics, and we may have blind spots there where other collaboration can be. Antimicrobial resistance has been mentioned as one of them. Impact of climate change on human health and veterinary health, and do we deal with counter measures? The impact of climate health and environmental pollution as well on both health and communicable and non-communicable diseases. Environmental risk assessment, both for the use of medicines, but pesticides, herbicides, and they are all under different regulatory frameworks. We have the initiative that's going to be channeled through European Chemical Agency of One Substance, One Assessment, which tries to bring together data on substances that may be used, that may be common for use in different sectors, but then to bring together toxicological data and whether it would really fit with the one substance, one assessment, that remains to be seen. The second part of this question, how can environmental stakeholders be effectively integrated into institutionalized frameworks for pandemic preparedness? Pandemic preparedness is one of those areas where I would see it indeed as a One Health issue. ECDC obviously has a role to play there, but also EFSA, Food and Safety Authority, that has a responsibility for veterinary diseases, and the European Medicines Agency, obviously, with their part on countermeasures, so developing vaccines, antivirals, etc. The way we've worked through the COVID crisis. The environmental agency is not a new partner, but climate change has severe impacts on the spread of disease, and we've seen that through warmer climates in Europe. We see that diseases that originally did not cross, across the Mediterranean, all of a sudden they reach not only southern Europe but also Midwestern Europe, and we've seen that with diseases like blue tongue and there's other diseases as well. Dengue virus currently. I think that integration needs to be there much more than it currently is. Particularly, I would say, on looking at climate change, microplastics, environmental pollution, and how they impact on human physical and mental health. I think those are areas that we currently do not study in that extent and do work on, and those are really opportunities for the agencies or for the Commission to define a steer in that.
Thank you very much. Thank you very much for the answer. I think we might have just time for one very, very quick question before moving to the next speaker. Anouk, do we have something brief and crispy?
Yeah, well, maybe this one. I understand that the 5 directors see the added value of the One Health for their respective agencies. Has there also been done an economic evaluation to underpin this feeling, or is it planned?
Yeah, thank you very much, Hein, for asking that question. It's a very good question, and if you're looking for a return on investment, I don't think the economic evaluation as such has been done. It has been done, for example, I know that in the past for the impact of veterinary disease outbreaks, and I think also for the COVID. I mean, sure we can find there that and for veterinary disease outbreaks, I know for sure that economic calculations have been done on the cost of preventing versus the cost of managing disease, and prevention is always cheaper, but it's very often forgotten that because the economic damage that comes from a health crisis is huge, not only in terms of hospitalization and treatment or compensation for animals lost, but the economic damage very often goes beyond that, in having a severe impact on transport, travel, etc. I think that's that. But to answer your question, I'm not aware of any economic evaluation that would underpin this feeling. So it would be a good proposal to do, I would say.
Indeed, something to keep in mind for our joint statement. Ivo, thank you very much once again for your presentation. Please feel free to stay until the end of the webinar.
I will stay. I will stick around.
Please stick around.
And thank you for allowing me to present. Thank you.
Thank you once again. And now I think we can move to our next keynote of today, Andrea Gervelmeier. Just a very brief introduction. Andrea is a German veterinary doctor and infectious disease epidemiologist. She worked for FAO, for national public health and food safety authorities, and then she moved to EFSA. At EFSA, she took care of the crisis preparedness and emerging risk identification, and then she became responsible for animal health assessment. As we will hear today, she at EFSA, which is the Food Safety Authority, of course, oversees a large network of public health and veterinary health authorities who collaborate with EFSA and ECDC on One Health surveillance for transboundary zoonotic diseases. So, Andrea, very happy to have you. The floor is yours.
Yeah, thank you very much for inviting me. I hope you hear me well.
Yes, we hear you loud and clear.
Perfect. I'm not sure if I can move the slides myself. I don't see where, but so maybe you just go ahead. So thank you very much for inviting me. Sorry. To talk to you about a practical example of implementing One Health approaches together with ECDC, EFSA, and the member states. Next slide, please. Yes, so it's about the coordinated surveillance systems that countries operate under the One Health approach for cross-border pathogens that threaten the Union. And these activities, next slide, they are based on two pillars. The first one being a direct grant opportunity that was available in the EU for Health Program 2022 for a 3-year project starting in 2024 and ending at the end of this year, in which 23 countries, that's 22 member states plus Norway, are carrying out surveillance with the, in animals and the environment with the aim to early detect zoonotic threats for public health. So what they have to do or had to do is initially to carry out a national risk and priority assessment, then obviously start collecting samples and carry out testing, and where necessary do whole genome sequencing to identify which subtypes are actually circulating. Then their task is to share their data nationally and also with EFSA, and to participate in national but also EU assessments. And then finally, the project allows to address capacity and awareness gaps, and countries also have to contribute to EFSA's regular reprioritization exercises. I'll tell you more about that in a minute. The second pillar, next slide, please, is the scientific and technical support that EFSA is providing to these countries under its mandate that it has to has received by DG Sante. So under this mandate, EFSA has had to identify the priority zoonotic risks that were to be covered by this One Health surveillance, and we've done this in close collaboration with the countries and ECDC. And then for those priority zoonotic pathogens, EFSA has proposed sustainable surveillance strategies. Both of these points have been published, and you find the links to these reports in the slide. And then obviously EFSA had to develop data models and also data collection tools so that countries can fulfill their requirement to submit the data to EFSA. And then we've developed several dashboards, sharing opportunities to show the surveillance outcomes with the member states and stakeholders, particularly ECDC and the Commission. And then we utilize the results that are generated by countries through this surveillance for risk assessment and priority adjustments on a regular basis. And I'll tell you a little bit more about that. Now, next slide. Let's have a look. Oh no, first I'm going to explain to you how we collaborate. So for EFSA, the mechanism to collaborate with member states is our scientific networks. Therefore, we have established a One Health surveillance subgroup under our animal health network, where we have annual meetings, we organize webinars, we have a shared workspace and communication channels. And part of this subgroup are the representatives of each of the we call them One Health surveillance countries, the countries and the organizations who have the surveillance grants, and ECDC. And in the table below, you see the composition of the subgroup reflecting the One Healthness, the involvement of the different sectors. So for 16 of the countries who have this direct grant, who do this One Health surveillance, both public health and animal health authorities are involved in this and part of the subgroup. Only 2 countries are actually involving 3 sectors. In addition to public health and animal health, also the environmental sector. That is a little bit of a more difficult aspect, and that's usually linked to the very different mandate that the environmental health organizations, institutions usually have. And then there's 1 country where we only have public health represented and 4 where it's only animal health. But we are quite happy that at least the 2 sectors of public health and animal health are involved for most of the countries. Next slide. Yes, so now I'm going to give you a quick overview of the results of this One Health surveillance that have been achieved in 2025, with the caveat that the final corrections, amendments are being done. So this is not the final data set. Next slide. So on this slide, you see, I hope you can read it, you can see the different pathogens on which countries are carrying out surveillance in animals and the environment. And the colors show you the country. So we have avian influenza, we have Borrelia, Coxiella bonnetii, Crimean Congo hemorrhagic fever virus, Echinococcus granulosus, hepatitis E virus, new currently unknown infectious pathogens, and then Rift Valley fever, swine influenza, tick-borne encephalitis virus, and West Nile fever virus. And you see that for each of the priority pathogens, there's more than one country carrying out surveillance and also reporting results, and also usually a given country works on more than one pathogen. Next slide, please. So here you see the effort that countries have done. So we have received from all the countries who are participating data on more than 88,000 samples, and more than 100,000 results have been submitted for these samples. The number of results is higher because sometimes samples can be tested for more than one pathogen, and so that's, I think, shows how much effort countries are really making in this One Health surveillance. Next slide, please. And on the left side, you see the distribution of in which months the samples are collected for the different pathogens. So the sample collection goes on throughout the year, with a little bit of less sample collection in the winter months. And then on the right side, you see the number of results that have been reported for the priority pathogens, and 2 tick-borne pathogens, tick-borne encephalitis virus and Borrelia, are the ones for which most of the samples have been collected and tested, but also avian influenza and West Nile are really looked at with a lot of effort in these countries. Next slide, please. And what we also do is we juxtapose the vector occurrence data that countries are generating when they are doing surveillance of vectors, and then testing them for pathogens by providing the map that shows the pathogen detection in the vectors and the number of vectors that are collected. This is an example of our dashboards that we are providing for countries. And then next one, please. So just in summary, what are the most important findings that countries have generated in 24 and in 25 by these surveillance activities? I think it's really important and very impressive that West Nile virus has been detected for the first time in 3 countries. in 24 in Latvia and Estonia, and they were found, the virus was found in European goshawks. And in Belgium, it was detected for the first time in 25 in Eurasian jackdaws and carrion crows. So that's quite an impressive achievement. And I think equally important and relieving is that through the surveillance activities, no Rift Valley fever virus positive samples have been detected. Rift Valley fever is a disease that we currently do not have or believe not to have in the EU. And also Caribbean Congo hemorrhagic fever virus has not been found, and that's a disease that is present in some countries, but not at a high level. And also encouraging, but understandable, because that's not happening every other day. No new pathogen has been identified. Next one, please. Now I'm going to tell you a little bit about what kind of review we are carrying out with countries and ECDC on, well, how much the One Health approach is being achieved, implemented in the countries. And please take note that what I show you now are the results of the first year, so after 1 year of doing this. Next one, please. Yeah, so we have asked countries to respond to 5 questions for each of their surveillance components. On this slide, you see for each member state how many surveillance components they have for the priority pathogens. And the questions that they had to answer were, have you achieved the aim that you identified for that surveillance? How much has the information that you generated through your surveillance increased your understanding of the epidemiology of this disease? What was the cross-sectoral involvement in the different stages of surveillance? How much has the information you generated been used in intersectoral discussions? And then finally, how much the information has been used for decision-making, and which sectors were targeted by the decisions? So next slide, please. So here you see 5 diagrams that show the degree of intersectoral collaboration in 5 different stages of surveillance. In the design of the surveillance, in the phase of collecting the samples, of testing the samples, and then during the phase of analyzing and interpreting the data and generating the information from the surveillance, and then dissemination of the information. And so if you look at the center green areas, that's like where all sectors have been involved. And you see that the numbers are not yet very high, but I think it's good, encouraging to see that in the crucial stages of surveillance, being the first one, you design it to make sure that all stakeholders are involved in identifying what you do, what the aims are. And in the final one, recipients of information, we have the highest value. And I think that's okay, in as far as it is not necessary that all stakeholders are involved in the collection of samples and their testing. So next slide, please. So what you see on this slide, the 2 figures show you the degree of intersectoral collaboration, discussions, on the left side by member state, and on the right side for the different priority pathogens. If we look at the left side, on a given bar, the left side, the gray bars show you that where there was no intersectoral discussion, so we see that still not all member states achieve a good degree of discussion with the different sectors for all of their surveillance components. If we look on the right side per disease, I think it looks a little bit more encouraging, specifically for the pathogens where we have repeated outbreaks, for example, West Nile virus and avian influenza. There seems to be already quite some good, useful intersectoral discussions. Next one. And this is about using the surveillance results in decision making. The 2 charts, again, on the left side is about by member state, on the right side by pathogen. And again, decision making so far not so much use of the surveillance results in several countries for all the surveillance components. But again, if we look by disease, we see, for example, for West Nile that the data has been used for decision making, on the one hand targeting the public health sector, but also the animal health sector. So I think we can say that these results having been achieved, after 1 year of setting up the system, the cross-sectoral collaboration is already quite encouraging. Next one, please. And obviously we are repeating that now as we speak. The questionnaire survey, which results you've just seen, is being finalized as we speak, and we can already see from the first analysis that the collaboration between the sectors has improved comparing to the first year. In addition, we are also carrying out interviews where we're trying to dig deeper with selected countries into how they interpret the negative results that they are achieving, but also whether they are analyzing the effort that they are making versus the value of the information that this is generating. And then also we will try to find out what would be needed to sustain this surveillance by achieving funding from the national competent authorities. I mean, would they do that? And if they wouldn't do it, what would have to change to be able to increase the sustainability of these efforts beyond the project life? And now, next slide, please. So I would like to close with highlighting some joint activities of EFSA and ECDC and the countries that would build on or are building on the One Health surveillance achievements. Next slide, please. So on the one hand, there's a current survey that has been created by ECDC, where both the public health sector and the animal health sector, and this is the One Health surveillance subgroup included, on the xenomonitoring practices for West Nile, dengue, and chikungunya virus surveillance. So xenomonitoring intends the monitoring of the vectors. So for the West Nile virus surveillance in vectors, that's where the One Health surveillance subgroup is contributing. And if countries agree, we will probably also be able to use their data in the overall assessment of that survey. And then there is an ongoing work of ECDC and EFSA, monthly West Nile virus epidemiological reports, and we are establishing how we can use potentially the One Health surveillance data generated on West Nile in these reports. And then finally, that's something that's still being developed, an assessment of the current situation of Crimean Congo hemorrhagic fever in Europe. Next slide, please. I think, yes. So closing with an outlook on what are the next steps. Next one, please. We are very happy, and so are countries, that in the EU for Health program 25, there was or there is another opportunity for direct grants to continue this One Health surveillance work, and also EFSA has received a new mandate to continue supporting countries in these efforts. So we are quite happy to continue for 2 more years in 27 and 28 with the countries in this work. And I think with the next slide, I would like to close, and I'd be happy to answer questions if there are any. Thanks.
Well, thank you very much for this rich presentation. Anouk, do we have any question in the chat?
Yes, there is a question. So the EU member states report on zoonotic pathogens under harmonized EU legislation. Do you use this reported data, or do the participating countries in your project report separately to the project?
Yeah, so EFSA has the policy to avoid double reporting requests. So if member states are already reporting EFSA data to EFSA for one activity, we are making sure that in this case, the data that is generated by the countries on under the One Health surveillance for pathogens that are covered in the EU zoonotic report is forwarded by EFSA. So it is included in the report, but countries have to report it only once.
Okay, thank you.
Thank you very much. I would have one, or sorry, Anouk, do we have any other questions in the chat? Otherwise, I would have a question. I mean, I'm curious about the One Health surveillance subgroups. Were the members of the subgroups already familiar with the One Health approach, or were there any case in which a country or a member was not so much familiar and they have to get used to this kind of intersectoral collaboration?
Yeah, I think it's obviously, I mean, these are a lot of countries, 22 member states plus Norway. So in a range, I mean, in some of the countries, there is already a certain degree of cross-sectoral collaboration, usually between public health and veterinary authorities. In others, it has not been existent before. So it's been established. It's being established under this project, and I think that, for example, building on the feedback we received from the last year meeting of the One Health surveillance subgroup, the bringing together all these countries who are in different phases of establishing the cross-sectoral collaboration allowed them to really learn a lot from the different experiences made already in some countries, exchanging on challenges and solutions identified. So we have a wide range of getting there, but bringing all of them together in this group helps really to bring everybody a boost in their endeavors to set it up.
Okay, so it was indeed also perceived as a big benefit for the countries that were not so familiar as well.
Yes.
Well, thank you very much, Andrea, for your presentation, for staying with us. I think we should now move to the next and last keynote, but please feel free to stick around until the end of the webinar. I would like now to give the floor to Carlos Das Neves, our last speakers. Just a brief word of introduction. Carlos is the chief scientist of EFSA, the European Food Safety Authority. Before that, he was director of research and internationalization at NVI, which is the Norwegian Veterinary Institute, and he's also professor at the Arctic University of Norway. At the moment, besides his position at EFSA, he's also co-chairing the One Health high-level expert panel. OLEP, as you all know, this is the panel that advises the quadripartite, WHO, FAO, UNEP, and WOA. And he has a vast experience on animal health, food safety, wildlife, emerging diseases, One Health, and so on. So, Carlos, happy to have you here. The floor is yours.
Thank you very much, Ludo and colleagues, also from the Health Platform, and thank you very much for bringing us the agencies to this forum, to this discussion. I think my colleagues have said more or less everything that was to be said about how we are trying to do it from the agency sides. So I've been given 50 minutes here at the end, perhaps to share with you more, perhaps of a personal reflection on this journey, and perhaps leave on the table some suggestions and unanswered questions, hoping that you can all think about it and perhaps help me answer. Perhaps here a disclaimer. I mean, as you heard, European agencies, we have a unique function that we are a bit in this middle step between understanding the science is there and mobilizing it to give advice to policymakers. So here, as in this cartoon shows, we do a bit of this rope walking back and forth, trying to make sense of knowledge so that policymakers can use it as best as possible. I think everyone here that's joining me today doesn't really need a pitch of why One Health is important, but if I had to do it very quickly, allow me to show you 3 figures and allow me to focus, of course, on food, but I could have chosen any other topic. Why does One Health matter and why does it need to work for real? We are in a continent where the impact of climate change is being felt. Pick your region on that map, wherever you are, something is happening, and this happening is impacting our capacity to produce food. And truth be said, the way we produce food is also leading to some of these changes in climate. When we talk about food, even in the most safe continent on the planet, with the best system of food safety, both in terms of scientific support and monitoring, we have people dying from food disease outbreaks, and we have thousands of outbreaks. And perhaps last but not least, and the most compelling arguments, even in the richest continent of the planet, around 9% of the European population is not able to put every 48 hours a dinner on the table that is healthy and nutritious. And it's easy to think that being food so an interlinked of so many topics without One Health, we will not improve these figures, and we desperately need to do so. Now, we're not lacking scientific discussions and One Health conferences I try to illustrate here. We have many of them, but I'm very happy that the platform has also decided to bring this topic to their focus. And truth be said, we are also not lacking any more strategic documents and recommendations on how to get this job done. I just put here a few examples. I will not dive into all of them, but I will return to a few. For us from the European agencies, there are 3 elements on this One Health, which are of course important: the science, the policy, and the politics. And over the last 1.5 years, we've actually more or less got the 3 covered, and let me use the expression, a bit under control. On the science, and here I use the example of the Lancet One Health reports, 1.5 years ago, an international group of scientists around the planet got together and put on the table 10 strong recommendations, recognizing the interlinkages of these socio-ecological systems we live in, where everything is interlinked, and where these solutions, these implementing solutions, need to be interlinked. And this picture just tries to illustrate what scientists have said. So the scientific support for evidence for implementing One Health is in place. I choose these reports. Many of you will know I could have chosen many, many more. The policymakers last year, for the first time in history, in European history, also got really together on a conference dedicated to them. Perhaps some of you here will find yourselves in this picture. And this was an interesting first-timer of listening to a few scientists, very few, but a lot of policymakers trying to brainstorm how do we get the job done? How do we deliver on all these scientific recommendations? And not surprising, they made their own recommendations. And just 1 month ago, colleagues, for the first time as well, the political heads of state and heads of government got together also to acknowledge for the first time the importance of implementing One Health, and as One Health is an essential for this public good, which is global health, which is food security, which is climate adaptation. All these are political hot potatoes. They recognize One Health will help make the difference. So we have the science, we have the policy focus, we have the political focus. Now, for us sitting on an agency side, and both Ivo and Andrea highlighted this long path, let me say it's also about these 4 pieces of the puzzle. We're right there in the middle, and for us to succeed in this mission, we need, of course, that the political and the science are aligned and that they speak to each other. So the dark blue and yellow piece of the puzzle, not always easy. Politicians very often reactive, scientists very often disunited. But we sometimes forget the other 2 pieces of the puzzle, and they need to be there as well. We need society to be on board. Society used to be uninterested. Now, perhaps the biggest challenge is they are misinformed very often. And we need the private sector that is unconvinced very often, that needs to get on board. And let me recognize and accept that, we like to say in agencies, we are also a bit under stress, but all these pieces of the puzzle are also under stress. On the political side, because we have too many threats, too many emergencies to cover, on the private sector because we have innovation challenges and ongoing economical trade wars. Society because trust and fake news are a difficult ping pong. And for many of us living on the scientific academic institutions, we're always a bit covered on the essence of resources scarcity, financial and humans, a bit of an absence of networks, and at sometimes a bit cannibalism for funding. With all of this, you would say it's not possible. But I think my colleagues have shown in the last 1 hour, it is possible, and for our sake in the European agencies, it is happening. Let me remind everyone 2 transforming documents that help this happen in real life out there in the streets. First, Europe has endorsed the quadripartite joint plan of action. This is a very specific action track oriented document on telling member states how to get it done. And they've even moved forward to have a real guide to implement it at national level. How do you do it in your own country? How do you transform these scientific recommendations into applicable solutions on the ground? And WHO has further on that. And of course, recognizing that at the European Union, we've also waken up, not just the agencies, but the European Commission. And as many of you will know, there is now in place a One Health governance document by the scientific advisory mechanism of the Union, highlighting in 6 recommendations, telling the Commission in 6 high-level recommendations, how do you get the job done in the way you are organized, in the way you do policy, in the way you support member states. You've heard, and Ivo has shown very nicely the example of the cross-agency task force. And let me also remind you that it's an example where agencies were motivated, we wanted to do it, but also let me say there was political momentum. And just here one slide that Ivo didn't show, that's why I wanted to show you, is that at the end of COVID, there was this huge political momentum. This is just an extract of these reports at the end of COVID from the European Parliament telling us you need to integrate One Health into policy making. You need to get the agencies together and to get the job done. And I think, and I hope you will agree after hearing, that the job is being done with specific examples of joint risk assessments, collaborative activities, and so on and so forth. But as I move towards the end, I want also to challenge you, if we want to make this work even better, what's going well, what's going more or less well, and what we may still be missing. And this is a very personal opinion, so take it, of course, with a pinch of salt for that. But first, on some of what we like to call institutional elements, and here just to show you. Do we have a formal One Health strategy? I said, well, we're on the yellow, and I will show it to you. Oh, sorry, apologies, there it is. Yeah, we are a little bit there, because we have already a governance, but you see here, is it highly politically backed with financial tools? Well, not yet. Do we have legal frameworks that help to fulfill One Health? We are trying. I have to recognize and give it to the legislator is extremely complex. But we're trying to do this in the pharma regulation, we're trying to do this in the risk, in the chemicals regulations. So there is a desire to regulate and to legislate in a different way, recognizing this interconnectedness. But of course, if the other one is on yellow, this is even far behind. Despite our best attempts, even for most of the agencies, it remains difficult to bring all underrepresented sectors. We keep speaking, we forget the environment. Working in food safety, my colleagues in plant health feel very often also forgotten, including on the nice Venn diagram. But plant health for us in food is an essential element, even if it does not give you zoonotic diseases. We are doing good in sharing practices, and my colleague from EMA has shown this practice sharing and how we are exchanging experiences. And I think we're doing our best to translate science to policy. But if we do it at agency levels, and if we convince the Commission to do it as well, as long as member states don't do it, we have a problem. And here I don't put the speedometer, I put a question mark, because at least to me in EFSA, no European country has asked formally for a lot of help for establishing national strategic approaches to One Health. We help them in AMR plans, in One Health surveillances, like Andrea has shown. But if they are establishing more structured One Health governance mechanisms within their own countries, at least to us, we haven't reached that request for help. Thinking that many of you are scientists, also in the science, where I said we have all the science we need, perhaps I was being ambitious. We never have all the science we need. And in science, perhaps, we also have still a path to go. We've done a lot of work over the last 20 years to coordinate initiatives, to share best practices. The European One Health Association is that space for excellence, for sharing these best practices, where the knowledge of more than 20 years is sort of all packed together. It's a one-shop. You go there, everyone that matters in One Health should be there. If you're not there, you're missing the right spot to be. But, of course, in connecting science, in motivating scientists to work transdisciplinary, we may be missing some of the incentives, and we may be missing the financial instruments, and we may be perhaps evaluating scientists not in the best way if we just think of their H index and we do not want them to engage with stakeholders and with the population, we're perhaps not doing One Health. So in supporting this nexus for science, the lack of sufficient instruments and frameworks can be an hindrance. And here, as we discuss the next research framework program, I of course leave up in the air, are we still missing a renewed form of partnership or financial mechanism to support, not just perhaps developing One Health, but now really implementing it? We had a successful EGP One Health said 6 years ago that it finished. That, of course, brought this to the table, created knowledge. Perhaps now it would be time to have a partnership that, more than creating knowledge, is able to mobilize. Now, is it a partnership? Is it an European research area activity? I don't know, but the time to question if this still needs that type of support is now. And I believe that without these all speedometers moving more to the green, this walk the talk will always be a bit difficult. I have 2 minutes left to give you one last message, and I'm not doing it myself. Here at EFSA, we benefit from having every year more than 100 young trainees. They come from all different fields, food safety, but we also take trainees in our legal department, our finance department, in all the domains of EFSA. And 1 or 2 years ago, they got together. So the video is a little old, but I still think it's the best one I have, and I love it. And I think in 2 minutes, they are much more compelling about the need to change and the need to walk the walk, to walk the talk. So I invite you to watch, and I hope the sound goes well, but it has subtitles anyway. And with that message, colleagues of Let's Do It Now, it's really, as I mentioned, the challenge is to walk the talk. But let me finalize with telling you one thing. Just because I focus on we are walking and the agencies are trying to walk together, we need to continue to talk. And you will allow me, of course, today, I mean, I'm Portuguese. I have to say we're celebrating our national day here today in Portugal. And I would be omissive not to tell you that if you want to continue this talk, of course, the place to be and to do the One Health talk will, of course, be in Lisbon and in Portugal, where we hope to host as many of you as possible for the World One Health Congress. And with that, thank you for your attention. Thanks to my colleagues from the agencies also for sharing our experiences. And thanks to the platform and to Ludo for bringing this topic today. Thank you very much.
All right, thank you very much, Carlos, for really bringing all the pieces of the platform together, of the puzzle together. We've talking a lot about platform today. Look, do we have any comment in the chat? Any question? I think we have a little time.
Yes, there are some questions. So the first one is regarding the societal dimension. So should One Health not also include investments in prevention, healthy behaviors, shaping conditions for good physical and mental health, reduced likelihood of illness?
And thank you very much for the question. I was just opening here the chat. Apologies that I could see. Absolutely. I mean, it's been a long discussion also of the relevance of One Health in non-communicable aspects. I mean, there is, of course, a preponderance to talk about zoonotic diseases, AMR, food safety issues, but we are recognizing, of course, that in terms, for example, of the impacts of pollution on health, but also on consumption patterns. And of course, all of these are a connect of disciplines. And no matter if you're talking of Ebola or if you're talking of obesity, prevention is always the best option. And prevention could and should perhaps be done first, both much more distal. I mean, we have a tendency sometimes to think of prevention of just, buying the respirator on the mask, but prevention starts a long way before that. So to your question, I would add yes, and perhaps the best place to do more One Health will be on education, not education of vets, doctors, and environmentalists, which, by the way, then we should also add economists, journalists, and politicians, and many others, but education perhaps of the small kids. The next generation will probably do it better.
Well, thank you very much for this remark. I think we have time just for one very, very quick question or comment, if any, in the chat, and then we will move to our closure.
I don't know if it's short. Well, the question is short, but the answer might not be short. So what do you expect from researchers, knowing that funding is still often siloed, meaning that they seem to be discouraged to work across sectors? Then it means it would not be easy to launch a One Health partnership under these conditions.
Yeah, I mean, we will probably, to be very straightforward and very quick, it is indeed not easy when the premises that we put before the scientists are very much still the strong competition and the focus on nature and science are the best achievement of your career. So perhaps without changing both financial mechanisms that facilitate more real collaboration. And I have to recognize there is an effort from the colleagues also in the research funding agencies to facilitate that, as we have tried with the social sciences. But having a full-fledged natural science project that you sparkle and say should add an element of social sciences, and then there's always a work package 7 or 11 or 12, which is social science work package, just so that the application gets through. It's first good attempt, it's not enough. So that needs to change, but then we also need perhaps to how we evaluate, how we engage with our scientists. If indeed the only thing that matters for your career progression is the number of publications and the citation you get from them, there will be also very little incentive to, I think there's a comment there, to engage with the citizens, to engage in transdisciplinary work. So perhaps that also needs a change, the way our scientific community operates. So yeah, we have a few barriers to get there.
Well, thank you very much for this remark, Carlos. I think this is particularly important coming from a professor. I mean, this critique of the academic system. I just am very much, I'm agreeing very much with with you. Well, thank you very much once more for being with us, for your contribution. See you in Lisbon. And now I would like to move to the end of our webinar, and by giving the floor to our colleague from the Commission, Elisabetta Rinaldi, for some just final remarks. Elisabetta, the floor is yours.
Thank you, Ludo. Just a few minutes. On behalf of DigiSante, let me thank you, Peitho, and the European One Health Association team for leading this network, and all the network's members for their engagement. And as the policymakers, we really appreciate that the future joint statement that is going to be drafted will take a bottom-up approach, and we are confident that this work will provide valuable guidance for both stakeholders, but also policymakers. As Carlos highlighted just a few minutes ago, we all acknowledge that there are several sets of One Health commitments, recommendations coming from the scientific opinions, the last report, Copenhagen recommendation, as well as the Lyon summit, among others. And this demonstrates that there is really a growing political and scientific momentum around One Health. It creates, of course, an opportunity which is valuable for all of us, but it's also a shared responsibility for policymakers and the stakeholders who need to move forward together. And what is needed now is to bring everything together, identify especially the common priorities, and to translate together these recommendations into the practical steps, rather than adding another set of recommendations on what should be done. Finally, from DigiSante's side, we hope sincerely that the strong collaboration that you established through this network of stakeholders will continue beyond the publication of this joint statement. And we would really welcome the evolution of this thematic network into a sustained forum where stakeholders can continue to discuss and advance implementation and operationalization of One Health in the EU. So good luck with the next steps with the joint statement, and looking forward to the next steps.
Well, thank you very much. Thank you very much for your words. And with this, I would now like to close the webinar, the series of webinar, really, echoing really what Elisabetta just said. So now it's really time to bring everything together. In these 3 seminars, we talked about the One Health networks, the underrepresented sector. We talk about equity and inclusion, very important. We talk about the EU research landscape, how to move from the research into the practice. Today, we heard about some prime example of One Health collaboration in Europe. We have our lesson learned. Now it's time to open our joint statement draft, bring everything together, and then publish. Well, thank you very much once again. Thank you very much to all the colleagues that joined as speakers, as attendees. Thank you very much for the support by the EU Health Policy Platform, and see you on the in the thematic network. See you in Peitho. Have a good day.
You went great?
Yes, you did excellent. I've already on the chat. And
Wait, I cannot hear you well.
Now?
Yes, now it's better.
Now I think yes.
Yes.
I've already have the chat and also the format of the chat with the both titles.